It is my distinct pleasure to welcome you to this 7th edition of the Africa Health Business Symposium.
What can the private health sector do in collaboration with the public sector and development partners to really drive the agenda of women's health? And with women's health, I mean all women from all levels.
Access to quality, appropriate healthcare, particularly for women, is one of the most pressing issues of our time and is specifically a major challenge in sub-Saharan Africa.
Let's think about solutions that are cross-cutting. Let's break the silos across our borders. These diseases don't know boundaries.
It is indeed in gatherings like this that we must do a soul searching that should bring to the surface pragmatic solutions beyond business as usual on matters of improving the health of women in the continent.
I'm honored to be invited to address this very important symposium focused on a WHO priority area, advancing women's health in Africa.
Dear colleagues and friends, it's an honor to address you today. I thank Africa Health Business for this invitation and for your work to close the gender gap in health and healthcare in Africa. We can start to close the gender gap through research that focuses on women's needs.
Only about 11% of African women surveyed had ever had any type of screening for cancer. No African country reported more than 30% of women having ever been screened for cancer.
The main reason for high cancer mortality include low awareness of cancer signs and symptoms, as well as inadequate diagnostic and treatment facilities.
The National Treasury has created a dedicated office that will receive and provide information to players in the private sector willing to do investments within the health sector.
The desperation of laying the foundation to urgently tame runaway adverse health outcomes in our population led our governments to run alone. But the time has come for us to walk far, and we must walk that walk together.
We try to engage the government, that is the policy makers, the regulatory authority, because we think that it's a symbiotic relationship. We do not exist by ourselves.
We use digital technology because if there's one thing that is changing the African continent at a speed that is beyond belief, it's the adaptation of digital technology.
This symposium has brought us together to remind us of the commitments we have made around women's health, appreciate the importance of a strong health system. We are also united in the urgent need to reinforce our collective efforts in addressing the risks that threaten the gains we have made in women's health.